Legionnaire's disease is a severe form of pneumonia caused by the Legionella pneumophila bacterium. Unlike the flu, you don't catch it from people, it's all about contaminated water. The disease was named after a 1976 outbreak at an American Legion convention, traced to bacteria in a hotel's air conditioning system. You get sick by inhaling tiny water droplets containing Legionella, not by drinking contaminated water. The bacteria thrive in warm, stagnant water found in man-made systems. High-risk spots include cooling towers, hot tubs, decorative fountains, and unused plumbing in large buildings. Legionella naturally exists in lakes and streams, but becomes dangerous when it multiplies in artificial water systems. Any system that creates and disperses water droplets can be a source if not properly maintained. Understanding this water connection is key to prevention. Legionnaire's disease is a hidden threat, but knowing where it lurks helps us stay safe. Legionella spreads when contaminated water turns into a fine mist. Think showers, fountains, or cooling towers. Breathing in this mist allows the bacteria to reach your lungs and cause infection. Anyone can get sick, but adults over 50, smokers, and people with weakened immune systems are most at risk. Chronic lung disease, cancer, diabetes, or immunosuppressant drugs increase vulnerability. Outbreaks often start in places where many people are exposed at once, like hotels or hospitals with poorly maintained water systems. Public health officials trace outbreaks to their source to stop the spread. Awareness of your environment, especially in large public buildings, is crucial. Knowing your risk factors helps you stay vigilant. Early symptoms of Legionnaire's disease mimic the flu: high fever, chills, headache, muscle aches, and fatigue. As it progresses, a cough, sometimes with mucus or blood, shortness of breath, nausea, diarrhea, and confusion can develop. The combination of flu-like symptoms and severe respiratory issues should be a red flag. Diagnosis involves a chest X-ray and lab tests like a urinary antigen test or sputum sample. Legionnaire's disease is treatable with antibiotics, and most people improve quickly with prompt care. Hospitalization may be needed for severe cases or high-risk individuals. Delaying treatment can lead to serious complications or even be fatal. If you have symptoms and possible exposure, seek medical help immediately. Early recognition and treatment are vital for recovery. Don't ignore persistent cough and fever, especially after being in high-risk environments. Preventing Legionnaire's disease starts with good water management. At home, set your hot water heater to at least 60 degrees Celsius, 140 degrees Fahrenheit, and flush unused taps weekly to prevent stagnation. In large buildings, regular cleaning, disinfection, and testing of water systems are essential. Building owners must maintain proper water temperatures and disinfectant levels. During an outbreak, follow public health advice. Avoid affected areas and monitor for symptoms. Families with high-risk members should be especially cautious and seek medical advice if symptoms appear. Ask about maintenance before using public hot tubs or pools. Legionnaire's disease is preventable with awareness and simple precautions. Good water hygiene protects you and your loved ones from this invisible threat.